Hey everybody, and thanks for being with us today for this important briefing. As you well may know or may not know, mosquito season officially began on May 1st, and it's important to everyone that we learn about the Zika virus. We're hearing a lot about it, and we need to find ways to prevent it. Zika is a viral disease that is spread to people through bites by infected mosquitoes. And I think the important thing for us today is that Richmond is one of the top 50 cities with the right conditions for the spread of the virus. But we have some good news today, and that good news is that some simple precautions can go a long way toward helping people mitigate the spread of the Zika virus. And that's why we've asked you to be here today to help us get the word out. The Department of Health has created a Zika virus website, and that website has a wealth of information on it. And you're going to hear today from Dr. Danny Avula from our health district, who's going to share some specific information about this illness. But the key today is that prevention is key, and that's what we really want you to help us do today, is to get out the word that prevention is key, and that citizens are truly our first line of defense toward the spread of this Zika virus. And so we want to ask the public to help us do three things. Help us stop mosquitoes from breeding by dumping standing water from containers around your homes, even small amounts of standing water. It's important for a day like today. Protect yourself from mosquito bites by using insect repellent, and then also to use screen doors to make sure that we keep mosquitoes outside and keep windows closed. So we're going to be working in a coordinated fashion to get the word out and to educate and inform the public of what they need to do. We're going to be utilizing our Channel 17. We'll be utilizing social media, advertising where we can, door-to-door hangers, brochures, fact sheets, and newsletters. And again, we appreciate you being with us here today to help us share this important information. And so we're going to have Dr. Avula talk a little bit more about the concerns related to Zika and how we can combat it. There are specific concerns about mothers-to-be and unborn children, and we want to be sure that people know how to protect themselves. Also, the city has a mosquito control program that Howard Glen is going to talk to us from the Department of Public Utilities. He's going to share a little bit about that today. But our mosquito prevention and control efforts won't reach into the homes of people or get into the consciousness of people until we get this word out. And so we need full engagement and full cooperation, and we want to thank people in advance for helping us to prevent the spread of Zika. Dr. Avula?
Yes, sir. Good morning, friends. Dr. Danny Avula, Public Health Director for Richmond City. And like Mayor Jones said, we are underway with mosquito season. And the good news is that city partners have been working together for months in preparation for this. The Health Department, DPU, DPW have been in close communication over the since February really, to prepare our city for this impending threat of Zika virus. You guys know a lot about Zika virus. You've been writing about it and reporting on it, and we've seen articles almost every day on the virus itself. I want to give you a few updates, and I'm happy to answer more questions after my colleague Howard speaks about mosquito control. I guess a couple of highlights. It's really important for our community to have clear and accurate information about what the actual threat of Zika virus is. And it's really important to remember how the virus is actually transmitted. This is a mosquito-to-person primarily transmitted disease. There have been several cases of sexually transmitted disease. A report just came out that looked at 6 nationally and internationally. So it's not a very common mode of transmission yet, but primarily mosquito-to-person. As of this week, we have 472 cases of Zika virus throughout the nation. Those are all imported cases. These are travelers who have come from Zika-affected countries and have brought it into the United States. In Virginia, that's 13, and here in the central region, 3, since we started tracking for Zika virus. Again, all imported cases. There has not been local transmission of this virus. An update on our response capability. One of the big changes that has happened for us, prior to 2 weeks ago, all of the testing for Zika virus had been running through the health department and going down to the CDC, which required about a 3 to 4 week turnaround for us to get a confirmation if the virus is present or not. 2 weeks ago, the state lab, DCLS, under an emergency authorization is now able to test. So that turnaround time is much quicker. We now can get a result in about 5 days. And just a couple of days ago, there's a private lab called Focus Diagnostics that has developed the ability to test for Zika as well. The details are still coming out in terms of how those tests will be routed and exactly who can be tested. But all of this to say that our response time around diagnosing Zika virus is improving significantly. A lot of questions have been asked about the vaccine, and because vaccine development has just begun in recent months, we're really looking at a couple of years at best before we have a Zika vaccine on the horizon. So the most important thing, prevention. As Mayor Jones mentioned, we have the greatest ability to prevent transmission by the work that we can do to control mosquitoes. These particular mosquitoes are called container breeding mosquitoes. They breed in shallow pools of water, and so the work that we can do to scan our properties, to dip over flower pots or children's toys and make sure the water hasn't collected, will really go a long way in keeping mosquito populations down. And I think it's also important to recognize that the greatest threat to our community is really in pregnant women. And so even if you're not pregnant, Zika is not a very severe disease for most of us, but we need to take on the collective responsibility for our community to look out for the members of our community who are pregnant or women of childbearing age. And now I'm going to allow my colleague from DPU to talk about mosquito control.
Thank you. Good morning. My name is Glen with the Department of Public Utilities, and I will share a little bit about the city's efforts to combat the emerging of the adult mosquito. The city has had an active program in its 7th year where we focus again on combating the emerging of the adult mosquito through larvicide. So our treatments are to treat infrastructure within the right-of-way as we tackle the mosquitoes in their larva form or in their adolescent forms. We've identified areas throughout the city based on their geographic locations that we treat on a 30-day to 45-day basis. Through those tests, we can determine if treatments are working, we can determine if we need to increase treatments, and so forth. The chemicals that we use are a biological pesticide, which is a BTI briquette. That is what we use to treat many of our storm inlets. Again, this chemical briquette is laid in inlets, and what happens is it releases a bacterial protein crystal that the young mosquitoes feed on. From that, it stunts their growth and again prevents them from emerging into adult mosquitoes. We feel this is the best practice in eliminating the mosquitoes that we're concerned about, because it also reduces the amount of using ground applications of treatment. So the city has a structured program. We're out in numbers. It has been successful. We have started this year earlier than the state mosquito season. We actually started on April the 1st. So we're moving throughout the city. We're available for questions. We also offer inspections if need be.
Okay. All right, with that, we'll take any questions that you might have.
So the mosquito treatment program, other than this, did you start early in response to Zika, or was that?
We have frequently started in April anyway, mainly because we begin our season based off of temperatures. If temperatures tend to exceed 50 degrees, we begin our mosquito program.
Okay. And so otherwise, is the treatment that you guys are doing just sort of the standard yearly treatment, or have you intensified your efforts in any way?
Well, we have had this program again for 7 years, and we've ramped up over the years. A few years ago, West Nile was a concern. So as we see progression in any of these mosquito-borne illnesses, we make adjustments.
Anybody else?
We're saying that mosquitoes are the main method of transmission, but can you talk a little bit about the sexually transmitted cases? How do those work?
Sure. So the documented sexually transmitted cases have been male to partner. So we don't have a lot of information about exactly how it works or how long somebody may be affected by Zika and can transmit it. But what we do know is that the virus itself lasts longer in semen than it does in blood. And so there have been, again, a handful of cases around the world that have been documented sexual transmissions. And so there's a lot of guidance on the CDC for specifically males who have been infected with the virus to either abstain from sex or to use condoms to prevent the transmission. For males who have been diagnosed with Zika, that is an 8-month recommendation. And for anybody living in a Zika-affected area, that's kind of the duration of the threat to use condoms or abstain from sex.
And if I'm a man and I've traveled to an area where Zika is prevalent, and how would I, number one, suspect that maybe I've contracted it, and then number two, what should I do?
Yeah, so one of the challenges that we're going to face with Zika virus is that 80% of people who contract the virus are not going to show symptoms. They're going to be asymptomatic. So for that 20% that does show symptoms, the symptoms are fever, joint aches, conjunctivitis, redness or inflammation of the eye. And so if any of those symptoms occur after having traveled to a Zika-affected area, then that person will be encouraged to go see their doctor, and then they would work with us at the health department to get tested and confirm a diagnosis.
Okay. Thank you very much. Thanks.